Hi, my name is Mike Pringle and I'm a consultant ENT surgeon, an ear specialist, and one of the directors of the Just Ears Clinic. The question we're going to ask today is, does earwax cause tinnitus? And the answer is no, it doesn't cause tinnitus, but some people whose ears become blocked with wax may experience tinnitus. Tinnitus is where you hear sounds generated inside your body which usually no one else can hear, and by far the commonest tinnitus sound is a continuous ringing or buzzing. Occasionally it can be pulsing or whooshing. There's always electrical activity going on in the inner ear and the brain, and sometimes our brain will actually hear that electrical activity as tinnitus. This noise is very quiet and most of us don't notice it, but if you put people in a completely soundproofed room called an anechoic chamber, over 90% of us will hear some tinnitus. However, the sound is so quiet day to day and the world's such a noisy place that normally we don't hear that background tinnitus, or we don't register it because the brain filters and analyses all sound it detects, and if it's of no importance, the brain ignores it and we don't become aware of it. When the ear becomes blocked with wax, your hearing drops, and so you can no longer hear the noises in the world around you. And then some people will hear the quiet sounds going on inside their head. And because the brain may be hearing them for the first time, it isn't sure what those noises are. It focuses on them and exaggerates them and worries about them. And so the noise is no longer filtered out and you'll keep hearing it. If you hear a pulsing noise instead of a ringing noise, it's because you're hearing the blood flowing through the blood vessels near your ear. Removing earwax with ear microsuction is one of the few treatments that will stop this type of tinnitus, because once the wax has been removed, the hearing will return to normal and the day-to-day sounds around you will mask out that very, very quiet internally generated tinnitus. Tinnitus is very common, affecting about 1 in 8 people. In fact, it's normal for most of us to occasionally experience short-lived bursts of tinnitus. If you have tinnitus that you're worried about, you should talk to your doctor, especially if the tinnitus is continuous and one-sided, if it's getting worse, if it's associated with a one-sided hearing loss, if it's a pulsing noise like your heartbeat, if there are any other symptoms associated with the tinnitus, such as dizziness, facial weakness, ear pain or ear discharge, or if it's causing you significant distress, talk to your doctor. If it's associated with a sudden hearing loss, see your doctor immediately. Although tinnitus can't usually be turned off, there are many things that can be done which will help settle the tinnitus and make living with the tinnitus much more bearable. Your doctor will be able to help you with these.